morning. So Mavis is here, and apologies.
You're listening in color.
To everybody who has been waiting for us to begin the show. Like I said, today's show is about fetal alcohol syndrome, disorder spectrum or spectrum disorder, and we'll be having a discussion about it. These are the more uncommon medical diagnoses that you'd hear, but they're extremely important in our setting. So, Mavis, if you're ready, let's take it away. Good. How are you?
I'm fine. Good morning to your listeners all over.
Alyssa, fix the mic.
Your listeners all over, and the viewers on Facebook as well.
Yes, but I think that you are a diaspora coordinator, so a lot of the diaspora nurses will be listening to you, and it's good to have that diaspora connection as well. So yeah, that's a good thing. So I hope your week was nice.
Yeah, it was stressful. I had some examinations here
and
there. I've not slept much.
The day in the life of a nurse undergoing specialty training. It's not pleasant.
It's not easy at all, but age is also catching up with us. So the brain is refusing to work. But well, we tried.
I refuse to ask you how old you are because your sister actually said yesterday that, maybe this is young. And I was like,
I'm very old. Don't mind it.
So listeners, we're on the Orange Health Lounge this morning, and we're joined by a specialist nurse in training, maybe ASANTE. Yeah. Maybe so what's so unique about fetal alcohol, spectrum disorder?
The unique thing about fetal alcohol spectrum disorder is that, it's a public health concern. It cuts across ethnicity, it cuts across politics, socioeconomic areas. Alcohol is in Ghana. Alcohol is in Ashanti region.
Alcohol has never left Ghana.
Yes, alcohol is at the peripheries. Alcohol is also in Europe. So the effect of alcohol in pregnancy does not really matter whether you are rich, you are poor. You will just have the effects. And one thing about we in Africa, and let me say Ghana to be precise, is that, like you said earlier, it's rare. Is it that we are really not checking for these conditions?
Okay.
Sometimes you have a child, the child is not doing well intellectually in school. Also, banana. Do you know that it can be because of the alcohol you took in pregnancy?
Really?
So we really have it. But the fact is we are really attributing these conditions to other things.
To something else.
Yes.
So I'll take my time and say this. Fetal alcohol spectrum disorder is as a result of who taking the alcohol? Is it the mother or?
The mother, the pregnant woman taking alcohol, yeah. And it's not like, we often say that it's only, let's say, early pregnancy and all that, but within all the trimesters, all the months, all the days in pregnancy, anytime you take alcohol, you can have this effect. In Ghana, we hardly plan our pregnancies. Seriously, obiasi afameni so. Apart from, let me say, the first pregnancy, if you happen to be married, that you are seriously waiting for a child. Aside that, any other pregnancy,
it's afameni so.
Afameni so. So by the time you realize you are pregnant, you've gone to a wedding. Okay. You've taken alcohol.
Or you've gone to a funeral.
Yes. And when I wish there was a female here for me to ask if she really takes alcohol.
Where's Alyssa? Alyssa is there.
And she would say, I don't take alcohol. Oh, alcohol dear.
But if you ask them of some sweet popular brands They'll say, oh yes, I take that one.
And the men too, the Christians, or let me say the other religions, sorry, Christians, they will say, oh, I don't take alcohol, it's just some wine, beer, and the men too, some beer.
So every alcohol is alcohol.
No amount is safe in pregnancy.
No amount?
No amount. Alcohol is alcohol. No amount is safe.
Wow. So whether it is wine, beer, what do you call that thing?
Even our local ones, pito, and fufu, and all that.
None of those things are safe in pregnancy.
No amount of alcohol is safe in pregnancy. And it will marvel you to know that our pregnant women, some might not be aware, but some of these herbs that they go for in pregnancy are actually mixed with alcohol.
Oh.
Yeah, so you would think that, oh, for me, I didn't take any alcohol in pregnancy. Meanwhile, you were taking other herbs, which would have been probably mixed with alcohol.
But what does the data show in Ghana? Like, are we? I'm curious. Is it something that we are seeing more, or we're seeing less?
Alcohol intake in Ghana, let me not take you far. So a study was done in Ashanti region, Lake Bosomtwe, and Ashanti region in general, 2014, 2015. Some were also done in Accra, Greater Accra region, then Jamestown. Okay. And you know, the finding was that pregnant women take alcohol. Some knew the effects as it can cause abortion, miscarriage, but they were still taking. Some take when they go to weddings and others. And one of the research also showed that married women mostly take the alcohol. Yes. Yes. So alcohol, in fact, globally, about 10% of people take alcohol. The numbers are high in South Africa. Okay. But it's still alcohol.
It's still alcohol.
It's still alcohol.
And there's data in Ghana to show that it's practice that is also common here.
Yes.
Wow.
Yes.
Wow.
In fact, in Accra, it was in Accra that they realized that some of the herbs were mixed with alcohol.
Wow.
Yeah.
Wow.
So you might think that you are not taking alcohol, but you are taking alcohol.
I mean, I'm forced to ask: is there a safe quantity of alcohol to take? Because you know sometimes people contend that you need a little bit of alcohol in your system to make your liver healthy. Ooh. Is there any truth in that?
No amount is safe. No amount is safe. We have some drinkers, we call them binge drinkers. These people, at a sitting, within 2 hours, they can take lots and lots of alcohol. It will increase your risk, but that does not deny the fact that any little amount, as little as just taking just a taste, a sip, can cause these conditions.
I don't know. I have never been pregnant, but why? What would compel a pregnant woman to take alcohol?
Like I said earlier, it's mixed with your herb. You don't know. In Africa, you are pregnant. You want to eat well. Yeah. Sometimes they think. Yeah, and also in early pregnancies, these signs.
Okay, the nausea, the vomiting,
yes,
the loss of appetite.
Yes. They would want to take alcohol, and as you go for a program, like I said, you don't even know that you are pregnant. You don't even know.
I maybe it's me. I have a very different opinion when it comes to a woman saying that she doesn't know she's pregnant. You know, you are in denial.
As a woman, I beg to differ.
You have one, don't worry, you have one.
Yeah, the first pregnancy fine, but the others are family. So seriously, You wouldn't know.
Mrs. ASANTE.
Oh, of course.
Good morning to you, Mr. ASANTE. The next one will come just like this.
Not at all.
She didn't know. So for some women, it's about the fact that they were unaware that they were pregnant, and then they may have taken a sip or two, a bottle or two of alcohol. And we're saying this morning that it's not just the one we think is alcohol. This is the spectrum from what we call local pito, insefo, whether it is sweet or bitter, cocktails, sweet alcohol. All of these things constitute what we're talking about this morning. So, I mean, it's quite a slippery slope for me if you think about it, especially when, like Mavis said, you're not, I don't say aware, you're not fully conscious that you're pregnant. So you're just taking a sip, or maybe it's the first trimester and all of these things are hitting you: the nausea, the vomiting, the dizziness, the loss of appetite, and then somebody says, so why don't you try this shot, this mix of herbal extracts, which usually has an alcoholic base. And that may just be your intro to fetal alcohol spectrum disorder. And like we've heard maybe say, this is actually here in Ghana. It's not far from us, it's here. And studies have been done in Accra and Kumasi and other areas to show that this happens. Someone would argue that does social demographic play a role? Is it that people who are from low income areas do this, or do affluent people also suffer this?
It's across board. It's across board. It cuts across all socioeconomic definitions. It cuts across. We are taking alcohol everywhere.
Okay.
We will say that in Europe, once the woman realizes that she's pregnant, she's taking less. But there are some also taking it. They don't mind. So alcohol intake is everywhere.
Alcohol intake is everywhere.
It's everywhere. Pregnant women taking alcohol is everywhere.
But you know the way a lot of our media, not this one, but a lot of our local media houses champion a lot of alcohol use. But I must say that some are really responsible and say, if you're pregnant, this is not for you. So, I mean, at least they make the effort. But in the first 0 to about 4 months, where probably you're not showing, you will think that you are fine.
Yes.
You will think that you are fine.
And you know that when some women are, one of the studies show that the women knew that alcohol intake in pregnancy can cause miscarriages, but they were still taking it. So maybe you are thinking that this pregnancy I don't want, so let me just take alcohol to terminate it. But it also increases your risk.
That's interesting.
For getting these conditions. So you are taking it now.
Okay.
But will also increase your risks in your other pregnancies for delivering a baby with these spectrum disorders. Okay,
so the intent then was that I'm going to take alcohol
to terminate
the pregnancy. Yes. And then it's a stubborn fetus, so it persists.
It's not like it's going to persist in your system.
No, I mean, like, the pregnancy is still going to go on, isn't it?
The pregnancy is going to go on. And once you take this alcohol, it will just cross the placenta. We know that in pregnancy, the placenta is going to deliver oxygen and nutrients to the fetus. We say that, wait a kakrebi. But no matter the amount, it's going to cross the placenta and get into the fetal circulation. Once it's there, the fetus will receive similar amounts in the blood alcohol concentration. So you are taking, let's say, a volume of 5%, your fetus will also be receiving the similar or same amount. And with pregnancy, the amniotic fluid will also act as a reservoir. So you have taken it now, but within the day, the amniotic fluid, the baby is still inside and it's still preserving the alcohol you took in the morning. So it will definitely prolong its effects.
Wow.
Yes.
Wow.
You are thinking that, oh, kakra bi na me nom ye, ekoye na koka ho.
You're listening to Orange 107.9. We're on the Orange Health Lounge this morning, and my guest is nurse resident and neonatal lead for GDNA, Mrs. I have to add the Mrs. Your sister says if I'm going to call you, I should add your Mrs.
Please, for my daddy's sake, call me Kuku.
I will not.
Call me Kuku.
Mrs. MAVIS ASANTE Ni Kuku. So it's we're discussing something that, someone in public health just sent me a message saying that it's really important that we have you who see the effects on the show right now, because there are some communities where the person you want to prevent from drinking alcohol is the seller or the preparer of the alcohol. So she's at risk already of this condition, but it's mainly because people don't even know how a child with fetal alcohol syndrome looks like. Yes,
and the fact is we attribute most of these things to a stubborn child.
Okay.
We mostly attribute it to stubborn child and all those kind of things, witches, wizards, but it could be fetal alcohol syndrome. Your child not doing well in school, your child very irritable, even social issues. Obano, anytime she's fighting with the friends, all these, alcohol causes a lot.
Okay.
We would say that, I just took a little amount. The liver of the fetus is not mature. It's immature. Considering all the stages of pregnancy. We have enzymes in the liver. We have dehydrogenase, alcohol dehydrogenase in the fetus. These enzymes are very low.
Okay.
And the action of these enzymes is less than 10%. It's less than 10% of what the adult one can do. So once you are taking alcohol, you are causing more harm than good. Alcohol contains ethanol.
Okay.
And it also has acetaldehyde.
Okay.
It disrupts fetal development. It inhibits cell migration. Protein synthesis, DNA synthesis. So the signs and symptoms, you will see that your child is supposed to have, let's say, a normal lip. But you realize that your child's lip is very, very thin. Very thin. The upper lip, especially. We have a groove at the top of our lips. If you can see, there's sort of, let's say, a runway on our lips. But you see that your baby's own is quite smooth. As a baby anyhow. All these are signs. Because of it inhibiting cell growth, you are causing loss.
So do kids or babies born to mothers who consumed alcohol, do they have a particular look? Like, do they have is there something you can see as soon as you see the child?
Of course. We have types. So some of the types, you can definitely see it very well. We have the fetal alcohol syndrome. This morning we are talking about the spectrum disorders, but we have the fetal alcohol syndrome. And that one, you use 3 cardinal things to identify it. The clinical features, like the facial features. Then growth. You see that you delivered at 40 weeks, or let me say 9 months, but your baby's size, your baby's weight is like a preterm baby.
Okay.
And you also see that they have CNS issues, seizures and all that. Irritability.
Okay.
Then we also have the partial fetal alcohol syndrome. With that one, sometimes there is no issue with growth. You see, your baby is growing fine. We also have alcohol-related birth defects.
Alcohol-related birth defects.
There are some congenital abnormalities that are linked to alcohol intake in pregnancy. Example, VSD, heart defects, kidney issues. Like we all say, for the general public, hole in heart.
Sometimes.
They are linked to
the underlying cause
is the alcohol. And some of these deaths occurring. You go for audits, you try to find out the particular cause of this death.
You can't find
anything. Most of these deaths are due to alcohol intake.
Calvin wants me to find out from you whether if the man also consumes alcohol, he can transmit it to the yes.
Yeah, we are yet to find out on that. You have to read more on that, but it's mainly about the mother. Mainly about the mother, but we should also realize that the sperm is also a cell. So you taking alcohol could also be inhibiting something in it.
Okay.
Yes, but it's mainly about the mother.
Okay, so it's mainly about the mother's consumption, and that is what affects overall how the child is going to grow, how the child, when children are growing, it's from a cellular level. So, okay, if you're watching us on, it's on YouTube, right? Yes, if you're watching us on YouTube, we have a very nice picture, courtesy the Cleveland Clinic, that shows how the child looks like, or the maybe so. Would you talk us through it?
Yes.
Please?
So, like I was saying earlier, you have the clinical facial features. You see this baby, and nobody tells you that something is not right.
It's not right.
Yeah, something is not. The head is small. The eyes are very small. The nose, the nasal bridge is quite small, low, or short.
Okay.
Then the philtrum is what I was talking about, the upper lip.
The upper lip.
We all have groove there. You see that the baby's own is quite smooth. There is nothing there.
I'm looking for mine.
Yeah, you have it. And the upper lip is very, very thin. Then we also have strabismus. Let me say any chill. Yeah.
Okay.
Then ptosis. Sometimes it could be. Sometimes your eyes, some people's eyes, you see that it's droopy. I say, neninu we bien so entimin biye. We bien so I say kata. All these have been known to be caused by alcohol. It's not only about the face. I said the growth as well. So in utero, you go for ANC. Yeah, you go for ANC. Your midwife measures your symphysiofundal height. They be out there never form.
Okay.
Obano, like 32 weeks. We are supposed to have plus or minus 2 weeks. So 32 weeks, we are expecting an SFH of either 34 centimeters, 32 centimeters, or 30 centimeters. But yours is like 26. Your baby is not growing well, and this could be alcohol intake.
Okay.
And even when the baby is born, they fail to catch up.
Okay.
By the end of age 1, we expect that a child should have tripled the birth weight. So if my birth weight was 3, by age 1 I'm supposed to get about 9 kilograms. But you see this baby still, apart from being a preterm baby, you see this baby weighing, let's say, 6. We have babies like that. Among the peers, even in childhood, infancy and all that, among the peers, you see that this baby
is too small.
Yeah, too small. And the issue is that in Ghana we attribute all these cases to witchcraft, spiritual, and all that. So it deters us from really identifying that this is fetal. Yes. And apart from the facial features and the growth, we also have, it affects every part of your body. We have structural, skeletal abnormalities, the structure. So you see that the fingers, some are, let me say, some cannot really straighten well.
Okay.
And even the phalanges, the formation of the phalanges, I say the fingers na kwa kakra.
Okay.
The angle.
Wow.
Yeah. Then even the vertebrae.
Where is the vertebrae? You are
at the at the back.
Okay.
Like the one we call spinal cord, but we know spinal cord is
it's not the right terminology.
Yeah, it's not
isn't it?
But for the sake of the listeners, let me say the spinal cord, the bone running from your neck, the back of your neck, the nape,
coming down.
Yeah, to the upper part of your bum bum. You will see that it's misaligned. Into I say obi wachia kakra. I say wachim. Let me say that wachim kakra.
Okay.
And all that dislocated joint and all that. It's as a result of alcohol syndrome. Alcohol intake in pregnancy puts you at risk of these conditions. And it's not only this. We have behavioral issues. In infancy, the child is very irritable. Obano osua oyene den. Onjai obi bikitu ebia. Ase onti ase masibia. Even in among the peers, not only in it's like throughout. Among the peers, no there be our issue. In school, they don't do well intellectually. You are attributing it to the fact that the child is not learning well and all that. The child might really be putting in their best, but still intellectually unbongoma. And that could be because of the alcohol you took in pregnancy. So alcohol has a lot of.
So it's not just the
No.
the physical features that you would see, but there are also features that have got to do with brain development.
Yes,
which will affect the child going forward.
Yes.
But these things are serious.
Yes.
But are these things that we routinely counsel pregnant women about here in Ghana? Like during our midwifery focused antenatal and all the conversations we have with them. Is this something that we talk about? It's
something that we talk about, but not much. Mostly. It only comes about when we see some of these signs. That's after delivery.
Okay.
And even with that, we expect extensive looks. With fetal alcohol spectrum disorders, there are some of the type that you have no features.
Everything looks fine.
Your baby's face, your baby's stature, everything, you can see that my child is very beautiful, but akrani subanye, akrana sweating.
It might be the alcohol.
Yes.
Let me announce the WhatsApp lines. Someone has sent a very interesting message. The WhatsApp line is 059-3932-993. 059-3932-993. 993. And this morning we're discussing fetal alcohol spectrum disorder. The person wants to find out if, let's say, somebody was an alcoholic before getting pregnant. Does this still happen to them? Maybe they were an alcoholic before getting pregnant, but as soon as they get pregnant, they stop drinking.
Oh, so it's known to be with the mothers who take alcohol in pregnancy. In pregnancy. Okay.
Someone else wants to find out if, let's say, the mother takes, let's say, marijuana in pregnancy. Does it also cause something like this?
Yes, in pregnancy, if you are taking marijuana, your baby will have neonatal abstinence syndrome, and that's also another issue.
Neonatal abstinence syndrome.
So you will see that your baby is sweating, your baby is yawning, your baby is irritable, your baby might have seizures and all that. That's also neonatal abstinence.
Abstinence.
It's also there.
Okay.
It's also there.
There's a voice note. Let me play it. I hope it plays. I've been trying.
Dr. Jima, please. Good morning. Dr. Jima, please. I have a question, and then I want to ask my question. My question is pretty simple. First of all, you guys are having a nice discussion. Orange FM this Saturday morning talks is all of education. My question is, I did my search and I found out that there are some liquid medicines that contain alcohol, like example, like the cough syrups. Does it also affect pregnant women? And then what is that alcohol different from the alcohol itself? Thank you.
All right, thank you very much. And like he just sent his, you can also send yours on 0593932 993 0593932 993. You can send a text or voice note this morning and we'll read it. So he's asking about cough syrups and other medications that contain alcohol. Is that alcohol different from the normal alcohol?
Once it's alcohol. That's why we advise pregnant women not to take over-the-counter drugs. Once you are pregnant, any issues you are having, come to the hospital.
You're right.
Come to the hospital. So no alcohol is different from other alcohol.
Oh, alcohol is alcohol.
Alcohol is alcohol. Alcohol is alcohol.
I mean, he makes a very, very good point because, in pregnancy, you have been pregnant,
Yeah.
You have this, sometimes you have this, if you are pregnant in this weather, you have this cough that doesn't want to go away. And it's sort of always there. And you buy this cough mixture, people keep suggesting cough syrups to you. For all you know, one of those cough syrups will be containing alcohol.
Yeah. I have not really read the leaflets of cough syrups.
Oh, some contain quite a lot of addictive products.
Oh, really?
So there are some cough syrups that have been banned in certain countries, especially the ones that contain codeine. And
yes,
those ones have been banned.
I remember.
Yes, but there are alcohols that are safe in pregnancy. But you know how things are. The people who sell these things to people in the general public, sometimes they're just selling stuff.
Yes.
So sometimes they're just selling stuff. So they don't really know that this woman standing in front of me is pregnant and that I shouldn't sell this type of medication to them. But maybe so, who is likely to be at risk of fetal alcohol syndrome? Like what's is that an at-risk population?
Everybody. Once you are taking alcohol, but the binge
drinking
drinkers, and also those who take other things. She's taking alcohol. She's also smoking. All these increase your risk.
Okay.
But it does not defy the fact that only the alcohol can cause fetal alcohol spectrum disorders.
Okay. So 0593932993. It's a WhatsApp line. So send your comment in by text or via voice note, and we'll definitely read it. We'll open the phone lines a bit later. It's Sao Anthony. I hope I pronounced your name correctly. He's saying that people also say that alcohol is good for the body.
Well, in pregnancy, please don't take alcohol. Alcohol is not good in pregnancy.
In pregnancy, even outside pregnancy, alcohol is not good for the.
I didn't say that.
I am saying
I
that.
am here for my pregnancy and their husband.
As a medical doctor.
Oh, okay.
Please. It's important that you don't take alcohol at all. But I know there are lots of myths about some of these practices in pregnancy. It's like when you're pregnant, people believe certain things that you must do for the sake of your unborn baby. Are there any related to alcohol?
Yes. So people often say that, small amount is safe. But like I've been projecting, no amount is safe in pregnancy. Some also say that it can only happen with the hard liquor, like the anodine pan, but no. Any amount, from the local pito in Senfufu that the woman will go,
the way you are saying it.
Oh, please, I don't take alcohol.
I haven't said you've heard somebody say some before.
Yes. Or they will say, but it contains alcohol and it increases your risk. And some also say that it's only in first trimester that you could be having these issues.
The effects.
The effects. The brain development is throughout pregnancy.
You're right.
So whether you are taking it first trimester, last trimester, you are still at risk. We also attribute it to stubborn child or bad parenting. Mama want to ne bani ye into ne bana so edin or ye kat want to cry on tnase. But no, it's a it increases your risk to neurodevelopmental issues. So it's not the parenting. You could even be a clergyman, but still your child will be having these issues. It could be the alcohol.
That you took from
not the clergyman, the woman, the pregnant woman.
They're all in the same soup together, because if you have it in your home, there's a high probability that the habit is going to develop. So can you only diagnose it when the child is born, or you can diagnose it before the child is born?
Before the child is born, you might not really be able to diagnose fetal alcohol syndrome, but you can see the signs. Example, the structural defects during your anomaly scans. But when the child is born, you get to see the face. As the child is growing, you get to see the growth. And you also get to see the relation with the central nervous system, the effects. Is the child having learning disabilities? Because I said some of these people out there are looking very nice, just that they are always having social issues, intellectual issues. Yes. So when the child is born with the signs, you get to know that this could be fetal alcohol syndrome. Like you have all the 3 markers. Some also, you see that they are growing well, but the signs are there.
You can see it. So, I mean, we have to emphasize, especially for our midwives and our neonatal nurses that the newborn assessment is extremely important.
Yes.
Because that may be when you may pick up, a small head.
Yes. But prenatal, in pregnancy too, we have to take notice of these things. We have to ask the mothers, but have a nice way of asking them. Because sometimes you say, do you take alcohol? The woman can say no, because the alcohol she is thinking about is the appeal, the one that's they take and hit their chest. She is probably just taking Fetal. So we have to probe, find a way of probing. And sometimes it's with addiction. The person has been taking right in her life before even getting pregnant. So stopping is quite an issue.
She has been used to taking
alcohol. Yes, she's addicted.
Yeah. Okay.
But if you are able to open up to your midwife or your obstetrician, we can refer you to the psychiatry unit or mental health unit. That is not to say you are mad. But it's to provide you with all the counseling services, all the necessary help you need to protect you yourself and your unborn child. And even in life, because it does not stop after pregnancy. You could still go back. Once in the neonatal period you are taking alcohol, it could also be excreting, or it excretes in the breast milk.
Oh.
Yes. So you've taken alcohol. Some of these mothers, when they come for
CWC.
child, yes, CWC. Oh, me bane dear, otimi da fine o. Otimi when nyane
I'm sorry.
Yes, it could be the alcohol you are taking, because I know this one. I am really sure the women take alcohol after delivery.
Hey.
Yes.
To do what?
To look nice, to eat well, so that they will say that the husband was taking or has been taking really good care of them. Yes. They say alcohol really increases appetite. If it's a large bowl of fufu, she can finish everything. So once you see the cheeks and the bloating, you see that yes.
she's being taken care of.
But you could be risking your child for abstinence, neonatal abstinence syndrome. Yes.
That's a really good
yes.
one. That's a really, really good one. That you may be taking. So it's not only about taking the alcohol early in pregnancy, even after you have delivered.
Well, after you have delivered, you will not be getting the fetal alcohol syndrome.
But you could
be getting the abstinence.
You're going to get the neonatal abstinence syndrome.
Yes.
Because alcohol will be excreted to your breast milk. The alcohol will pass through your breast milk.
And there are some rare cases that some mothers also give their babies alcohol.
Yeah, I think that I saw a chance on a video on Facebook, on a friend's Facebook, and this mother was actively chugging some bitters into the child's mouth. Why do people do that, though?
So when they deliver, what I know is that sometimes they want to go out, so they give the child alcohol so that the child sleeps.
They want to go out.
Yes.
Go where?
They want to go out, probably to the market.
Oh, okay.
They don't want the child to cry and all that, so they give alcohol. Other people too, it's just for the fun of it. They are taking the alcohol, the infant is there, take a sip. Take a sip. All these, they are bad for it, because in infancy, the liver, it's not like the adult liver. It's not that matured to be handling some of these chemicals. Yes. So and globally, about 630,000 children suffer from fetal alcohol spectrum disorders each year. So this year 630,000, next year 630,000. So at the end of the day, later in life, later in the countries, you need somebody for leadership roles, and
because in Nayabo.
yes, we can't really handle it. We have attitude issues, we have behavioral issues, we have intellectual issues, because our mothers are taking alcohol. So it's a public health issue. Your family, you yourself, you want to have, let's say, a child with a good job. In Ghana, we know quite a number of the good jobs. Not to say that anybody's job is not good, but you have some kind of particular job that requires intellectual uprightness. You are taking alcohol in pregnancy. Obano koskwa ombongoma. Ye ne hwie nye yi. 1 + 1 6. The teacher tries everything, but still. Yes, it's the alcohol. It is the alcohol you took probably in pregnancy. And the sad thing is that the effects are irreversible.
Oh, really?
Yes. So you delivered a child with a smooth filtrum. What are we going to do there? You delivered a child with a thin upper lip. What are we going to do there? For the structural effects, there could be surgeries. But some of the facial effects, some of the facial features, what are we going to do? Your child's head is small. So how are we going to make your child's head big? So some of the effects are irreversible, but for the cognitive, intellectual issues, in fact, they also have speech delay. They could also be they could also have issues with listening, hearing. Sorry. Some have hearing loss. Functional issues, like they can't see well. Myopia, astigmatism, and all that.
Just today I was this week I was doing clinic, and then someone brought their child. The child was about 4 years, and I tried, with kids you have to interact with them, and the mother was like, oh, she doesn't talk. I was like, are you sure she can hear? So as for hearing, she can hear.
How does she know?
But because this is a child with small head, strabismus, and does not talk.
Oh.
You understand?
Yeah.
So sometimes, even for clinicians, you have to put a lot of these things together, and don't think that the diagnosis in your head is also wrong. Sometimes you need to have this conversation with the patient to understand that I think it may be this. The person will deny 100% of the time, but as you encourage the person to open up because there is help, that is when you're going to see that there's more to what you're seeing.
Yes.
Because like Mavis is saying, the cognitive damage is forever.
Yes.
It's irreversible.
You could have therapists for them, but that's also an extra cost.
That's also money that
money that we all don't have. And that will also be, yours will be going into these things. Yeah. So once you can prevent it.
Like let's look at the prevention, because the long-term side effects are damning.
And it is the leading cause of preventable congenital disabilities.
Preventable
congenital disabilities. So when I talk of disabilities, I mean with disabilities we have the structural and the, let me say, the congenital anomalies. So alcohol is the leading, is the, once you stop taking alcohol, let me put it this way, once you stop taking alcohol, your risks for getting some of these conditions, the structural, the congenital anomalies, like let me say hole in heart, renal agenesis and all that, reduces. It reduces.
Okay. So, hey, good morning to your your sisters. They're all on our Facebook channel, Sally and Abena Coco. They're all on the pages.
Oh, okay. Hello.
And they're saying thanks for education. She's no longer anti midwife now; she's anti neonatal nurse. Okay, so good morning to you, Katechi. So Katechi's question is that, I'll open the phone lines in a bit, Katechi. Katechi's question is that he is aware that alcohol in pregnancy is dangerous. However, if the mother is already exposed to alcohol and has taken alcohol, and the parents find that this baby that they are carrying might have challenges in the future, please find out from your guest if that is basis to terminate the pregnancy. You know where Katechi is going.
Oh, Katechi, you know, we can manage, even though there is no cure. We can manage with early intervention, therapies, education, and behavioral support. And also, we can train the family and the caregiver to be assisting this child. So for I know you are talking about comprehensive abortion care. Katechi, you can't take that decision alone. So based on the findings and your preference and the team you meet at the hospital, that's when this decision can be made. So we cannot just be terminating pregnancies because of fetal alcohol spectrum disorders.
Okay.
So based on the gestational age, so it depends. It depends. So it's not like only the mother's request. The mother can request, the mother and husband, let's say the family can request, but it boils down to the team, you with your doctor, your midwife, discussing for the best. For the best.
He follows up with a question saying that if the person I'm with drinks secretly, and I find out, it's okay, if the person drinks alcohol secretly and I find out, should I be worried that my child may develop complications in the future?
Katechi, is the person you are with pregnant? So if she is pregnant and taking alcohol, Katechi, the child's risk for having the effects of alcohol intake, that's fetal alcohol spectrum disorders, is high. And like I said earlier, you should be worried, but worry does not really solve anything.
Yeah.
Talk to somebody, talk to your obstetrician, talk to your midwife, go to the nearest healthcare facility and seek help. Sometimes it's not like these women really want to take the alcohol. It has become an addiction.
I actually don't take the alcohol. Sometimes I want to take it too.
Oh, it has become an addiction. Like she has been taking it for quite some time. So stopping an addiction is quite not that.
I mean,
simple.
that it's a difficult thing. I mean,
yeah. So it's better you communicate. Communicate with your healthcare giver, and we will give you all the necessary support. Because honestly, we also don't want to be seeing these babies. Yeah, we know the woman. It puts you into so much despair. So we would want to help. So talk to us. Let's refer you, but we'll still be involved with the care. We'll be involved in the care as well. So just talk.
All right. So let me open the phone lines now on the show. If you've got a question to ask us, 0241 022 318 058. That's 024 0541 022 318 0541 022 318. And that is the call line. 0541 022 318 0541 022 318. And this morning we are talking about fetal alcohol spectrum disorders. And this is something that, you know, a lot of people shy away from it, Mavis.
Yeah.
They are not going to come clean. They're not going to come clean and say it. But let me pick this call and then we continue our conversation. Okay. Okay. There was a small challenge with the lines. Someone was calling. I think that they may have to call us back. 054 10 2233 18. That's the number to call. I know someone is on the line. Just give me a minute where we're connecting you. Hello, good morning.
Good morning, doctor.
Yes.
Papa continue.
Papa Kente, oh here.
Hello.
Papa Kente, say oh here. Hello. Hello. Okay. So sometimes the lines can be a bit challenging, but it's not from our end. It's from service provider. It's from service provider end. So apologies for that. You've noticed that recently there are some interruptions in the lines. Let me try again. 0541. Hello, good morning. Hello, good morning. Hello. Okay. So obviously this is a challenge. Hello, good morning. Okay. Kindly call back. There's a challenge with the lines. I'm sure it's network related. It's not coming from our end. But if someone is drinking secretly, okay, let me try and pick this call for one last time. Hello, good morning.
Good morning, doctor.
Papa Kenti. I feel you're okay, great. Pacho, let's go.
No pay the chia a Ghana phone na ya chia wajuma ifo ya no mo you producer will be a chia will be no pay the in fact my idea pa da mase. Na pacho on say asem the person can say wonyama wo yoba na wonyama ensa no mo no twe hu free ho ana doctor me boa
no.
Hello. Wonyam dia no ai dey what I know what you free one am party doctor ni bibi na nka me wo question but medical answer na da ho say obabu no no wonyama won no but wa wie no na wo no na no ye na almost ekum yamkuro omo say na ekum yamkuro eno no nze ya say ade e ho da oba anye wo pe anya apetesi obawie nya guru doctor
saa ho
adanya omo say ekum yamkuro omo say nya fufuo bi a ne nkwan de ya esi ne pa no nya guru kra nti saa ho no nso mbesere mo mienhwe hwe say ampasa akoho no mo no ma ekum omo yamkuro no say sanity. Why?
Yo, me that's 0541 022 318 0541 022 318. That's the number to call us on. Let me pick this next call. Hello, good morning.
Good morning.
Yes, sir.
Please share a woman taking alcohol something terrible, but so who say to say stone beer, beer, alcohol, beer near you, the cassava contain alcohol, millet to contain alcohol. Yes, a woody cassava, no, say is the same as taking an alcohol.
Okay, thank you very much for your
call. You understand my question?
Yes, I understand your question very well.
Taking cassava, palm nut tree, palm soup, they all contain alcohol. So taking it is the same as taking an alcohol or drink it.
Thank you. So that is not exactly accurate. That's not exactly accurate. For any carbohydrate to become alcohol, it has to go through chemical processes, for lack of a better expression, fermentation.
Yes.
It has to go through fermentation. So if you are eating cassava, if you're eating gari, and it's unfermented, it is not alcohol.
Yes.
So those who also use that as an excuse to say, some people even use banku.
Yeah, they say that banku no crowd say alcohol or even fancy kinky. Like they will let it ferment and take it. Say alcohol, but say but no.
I think that this form of rationalization doesn't help. Because people say, so now can banku has alcohol, and now say beer, banchin into a banchin amenum. No, it has gone through chemical processes of fermentation, flavoring, and other things. That's what makes it dangerous.
Yes.
So, please, you can make alcohol from anything. You can make alcohol from pineapple, from mango, from even yesterday I went for a presentation. I saw someone has made wine from konsuswa, turkey berry. Okay. Yes, so you can ferment literally anything. So let's not use that as an excuse to say because the beer is made from banche. So maminum beer. No, like Mavis has explained, the side effects are terrible. I think Papa can tell you something.
Yes.
And this one, me person can English. Yeah. What is this thing about yekum yemkro?
Yeah, me say yemkro is them what dear. Me I grab my idea bro so because a idea wo hopa me right from my childhood. A yensema mati. Say a man who we are there be a crow wo mo yem. Nti ya na mpese me bisa say a crow na wo stomach no more can na say e wo uterus no more can. But what way we physiologically your body is going to handle everything.
Okay, let me pick this call and then we'll come back to this Yemkro issue. Hello, good morning.
Hello, Dr. Jima.
Hi, Obapa.
Make us a free Tafunzongo.
Yes, Obapa. Also, my best out Tafunzongo. One of these.
Inshallah.
Amen.
Dr. Jima, me jidi sa ohoye pa.
Nyamiadum me hoye pa.
Sa me chiao etie fu nyina, tia doctor ode ne te woni nyina.
Yeah, that's it.
Yankopon onhira mu nyina. Do the Orange FM by kofa by ono so me tia ne pa. Yankopon onhira ne pa no anya ne kese. No entretre na shim. No ma Orange TV sombra. Yeah, bonya empire sa.
Okay.
If you see adie bebre, do me that say ya me na me ni age ankasa. Ya na ma bie ne kuha na obi etie bi. Onyankopon nkaso a fa nim bie ne bebre nka mo ho. Me nua be ma papa kente me tia wo pa be bia wo bia. Me pa cho doctor. De mpese me busa ne say on se e maba wa na dodo na ono nyinse ne wo mpe. Nti aso wo ne rounds na na se nyinse ne ba. Ono do bedum amanyinse na senkwa na oyo. So what I say, ono monsa wodo no oye niama wodo se de be ya nyinse ne be se na wo hia sobo nyinse ya. Wo ye den ya nyinse ne won sei. So what I say nti sa ba no na wo be wo no a wato chima no ene doctor echirechire mti mi sire ye niama ba wa no. Omuntie Orange FM no muntie doctor e ka no. Omo ya maba wan se ne de nga adwen o. Na nipa no waware awie na afe no opanyin sen no anaso ope ba na afe no de ahye efie meyifo ne wo mo a mo amba mre wa mo ti fie. Me se mo ani die mo a mo ntie Orange FM. Na Orange FM omo wazo yi ankasa. Yankopon onhyira mu nyina no onkoso onhyira mu. Me fie pa, me sa Fred question foforo so aba. Me ma obi bia assalamu alaikum.
Oba pa assalamu alaikum. Me da se pa and that's the said bia utie ye na obie ema obia so etibi mo amutie na pay me chia money na ye da masese mutie. Let's pick this call. Hello, good morning.
Hello, Doc. Good morning.
Yes, sir. Good morning.
Good morning, Doc. So, quick question. So, what happens if, say, the man, or if myself and my wife is pregnant and I drink alcohol a lot and I go to, top up? Can the sperm, alcohol in my body enter her through the sperm?
Good question. Thank you very much. Maybe she's smiling, so I'm sure she has an answer. Okay, maybe so. Let's finish the Yemko, and then we'll come to this interesting male-related question.
Ain't no Yemko na semne die mesre ema. Onyima ana owa edre wosa wonuma ye die o doctor ana o midwife e dia ma oni kwa alcohol ain't me koku Yemko bia. Enkuyem krobia bia. Any yebeka say any therapeutic effects. Alcohol now onum emma a therapeutic effect like enye de body ne kwa adepem. Ewe dromu. So se bibi na hawa go to the hospital. Go to the hospital. We have postnatal visits. The first 24 hours, the 3 days, the 1 week, the 6 weeks and all that. But even in this range of days, and so in our house, go to the hospital. And last time in America, Mami Fono, mostly a dry demand, lasted for 5 to 7 days. Aside that no obadi na say wa wode na akra ni pie free mobile no na o say a crab ma with breastfeeding no your uterus wa wode no ebe go back to abra onyem no say na na esitie one so no o personal hygiene say dey we see kra wo ho o pad no o keeping it and pad no e share from morning to evening there be at least 4 hours bia wa for na wo so otimi sesa o pad no ana abre bia emuafo abroso no enkono medro fufuro bia the body itself ebeye adwuma ni nyina enti dia wo doctor dia ma no nom asa doctor ma fufura enkoto bi nsoso se me yam kro ni nwi enti alcohol ne dia no it won't help.
Okay, but I mean, now that we're there, let's just give some medication to our pregnant or our postpartum mothers or women. There's this widely held conception that if you deliver, let's say by SVD, if you deliver largely by SVD, it takes a while for some crew, I don't know what crew they're talking about, to heal. And there are a lot of things that they do to sort of quicken the effect of the healing. So even after you've given them your antibiotics for a week, they still want to go and buy more.
Yes.
And that's when they come and they are told that, oh, you don't need any more. Then they resort to all sorts of things. Please, you are still a midwife and you are transitioning.
Yeah.
What can we tell them?
Like I always say, your midwife should be your friend. And when you check our ANC book, the maternal child health record book, you can see that the first page, the last end, midwife, attending midwife, and contact. So that contact there is for you as a client, you and your husband. anytime you need help, you need any clarification, you should be able to pick the number and call your midwife. Mommy midwife say in the medro na sound one can person me koto, then she will probably educate you. Maybe you are having some signs that need intensive examination. So don't sit home and say away there be your crona. Then go and buy any medication. Anything, report to the hospital. And I want to add up to Auntie Obape's comment. She was saying that the young ladies drink alcohol more and all that. So one of the studies done in 2014 was saying that the higher range of people who were taking alcohol was 40 to 49. And most were the married women. So yes, the youth is taking alcohol, but could it also be that the youth I said and because we see them in public taking the alcohol, and they are taking the alcohol more.
But most of the time, even the regular
the pregnant woman, the married woman, no, by now she is married into a better crowd. Nobody is looking at her. Or cost shopping, what alcohol, what on a wine, or the alcohol sifi. And they are sharing a fridge chili. So it's not only about the youth. We are taking the alcohol. The range was from 15 years.
Okay.
And they were taking, but the highest people the age range who were taking the alcohol was the 40 to 49.
Wow.
Yes. And they were mostly married women. And come here because say but they are also taking alcohol. So it's all of us, we need to really look into this matter and stop.
I think that's something that we need to sort of let people understand that let's not overly stigmatize young people when it comes to this. Even the so-called responsible ones probably do it worse.
Hello.
Hello. Good morning.
Good morning, Mr. Jima.
Yes, I hope you're well.
Yes, please. I hope you're also well.
I'm fine. Kindly go ahead.
Good work, Dan.
Thank you.
Yeah, according to Obape's question, she was referring to the younger ones that take alcohol just to terminate the pregnancy. She was not saying that they take alcohol for fun, but she said maybe they are not ready to get pregnant, but because of weight, but they were just going about taking alcohol when they know that they are pregnant, just to take something to abort it. Yeah, so she is seeking advice for these ladies. Thank you.
All right. Thank you very much for the clarification. Pardon?
Anyway. Queen Liz from Pastor.
Yes, Lizzie, thank you very much for the clarification.
You're welcome.
Yes, so go ahead.
If you are young and you are taking alcohol for the fun of it, like I said earlier, it increases your risk to deliver these kind of disorders. So for the fun of it, you want to terminate pregnancy and all that. It all comes with your increase in risk. So just don't go near the alcohol.
Let me pick this call. Just a moment. Hello, good morning.
Good morning, sir.
Yes, sir.
Yeah, my name is calling from Abuakwa.
Okay,
yeah, about the alcohol issue. I wonder why some of the companies, they started doing that is the herbal drugs, herbal this, herbal that, malaria drugs. And then now all of them, they are turning into alcohol. One of the companies like Adunku.
I'll prefer if you don't mention any specific brands. Thank you.
They are sponsoring the youth. None of them, all of them are follow. When you see their billboards are outside, those who started that, they are doing medicines, herbal medicines. Now, look at them. Now, see, their billboards are not, we don't see any more about the herbal medicines. What you see is the alcohol. And the youth also are patronizing. So please, when you pass by in the evening, like today, Saturday evening, when you pass by Bantama, other class, and then they use the ladies and the gents, all of them, they are taking alcohol. So please, we are talking about it. So we have to put pressure on even that companies to concentrate on their the medicine one rather than the alcohol thing. Thank you, sir.
Thank you very much. 0541 022 318. Maybe I wanted us to address the
interesting question.
But it was interesting.
Yeah, it was interesting. It was
so
interesting.
The man wants to know that if he decides that he's going to do top up, you know what top up is?
No, I don't.
But
I'll try.
Let me pick this call.
Find out.
Google what top up is. Hello, good morning. Owapa.
Hello, Dr. Jima.
Yes, dear.
Me pacho nanka me say friend na minia Lizzy efre except the me pacho no.
Yeah.
Nti me friend ma da Lizzy ase.
You.
Na masa da musuma se.
Yeah, that's.
Me pacho me question to mi no say. Me pacho obehu oba bi on. Wa wo be 4 to 5. Tem bia wanyim bia no obehu so gina bia ba no so gina mfitiri. No agire toto pack bi no de ahye ne bag. Me ma hu bi da. No, they are sending bag. Ubusana. A woman me, a bit nice and yes, and I was said by the Biblio. If you say, and yes, it's none of the doctor. A man on Coswanya, and I saw midnight. How about penny mood? The doctor teach you, must say, man, penny for now, so a rain son of class, same about one. And none of came mad to say, sad in the Mahubida. Nti nese man wo bebre nti nyinse na wanyam no onom nsa na ese yenye hwe onye obi a wo peba nti na mi busa se yenkoso anya sa ana asema yenye sa edamate nti e fo nyina.
All right. I wish there were some sort of legislation to stop sale of alcohol to pregnant women. I really wish that there was some sort of legislation to stop sale of alcohol to pregnant women. But we are all responsible for the kind of future that we're building. If you're selling alcohol to a pregnant woman, or you're even advertising alcohol to a pregnant population, you are putting all of us in some form of danger in the future. Hello, good morning.
Hello, good morning, Doc. So. Yeah. Yes, I'm back again. I'm still waiting for the answer, but I'll just a clarity on what you just said. You see, there is regulation. That is why, according to the FDA regulations, any alcohol or toxic or intoxicated advertising should have a disclaimer. So the people who go and drink it, who are pregnant, they drink it because they want to drink it. The people who are selling tells you that this is not recommended for pregnant women, lactating mothers, or people under 18 years. And still, the pregnant women will go and it's like cigarettes. They designed a lever that is spot on the box of the cigarette to tell you smoking is harmful. It can harm your liver. People still go and smoke. So no matter what, it's an attitudinal thing. You cannot stop them. And you, the person who is even selling to them, most times they tell you it is boldly on the counter, not recommended for women, lactating mothers, and people under 18 years.
Yeah, that's true. That's true.
So I think it's more or less attitudinal issue, and it's into be awful because you're very honorable. The best you can do is the Thank you.
Thank you very much. He said into be awful there, but so he asked the question and he's looking for an answer.
Oh, so fetal alcohol spectrum disorders are known with prenatal intake of alcohol. Into the matron say a yaria making. It is known with the woman taking the alcohol.
So say obaning him. Na be manu ko twebi. Na according to what the man said, okoye top papa. For now, dear media make us say
the eka who say media, it's with the woman. The woman taking alcohol. But you yourself now, you should identify that alcohol, no, can it not cause anything in your health? And like I was explaining earlier, alcohol really it inhibits cell migration, DNA synthesis, protein synthesis. And so let's say if early pregnancy and before you've met a woman, you the man is taking alcohol. You know the sperm is also a cell. Until you bringing this cell that has been undergone alcohol friendship, are you sure you are going to give her the best?
The best.
Are you sure you are going to give her the best? But you know, fetal alcohol spectrum disorders is like about the woman. But as men, let's also check ourselves. I watched a video on Facebook about a doctor talking about miscarriages. Sometimes a lot of women go through miscarriages, and it's all about the woman. You know, it could also be the man. The type of sperm you are also delivering to the woman. Yeah, so it's not only about the woman. It's not only about the woman. We said fetal alcohol syndrome increases your risk to miscarriages, stillbirth, preterm delivery, and all that. Could it be that it was your sperm causing this miscarriage? For the fetus, we can't say much.
Yeah.
But for the miscarriage, could it be it was due to your sperm? Yeah, so that's about it. And also with Auntie Obapa talking about people saying that it's just beer and I have more kids at home. Probably you have more kids at home. You are taking it to terminate this pregnancy and all that. But in fact, you could end up with a child with fetal alcohol syndrome, the severe type. That you yourself, you can't even go out to enjoy again. Your child has all these structural defects. Your child has growth issues, facial, like, you know, the stigma, urbanity, and all that. So once it's not helping, if it's not even about pregnancy, as we are saying, you as the woman, is alcohol going to help you?
Let me read this comment from okay, says my name is Selby. She's saying that let's also encourage our young women who are looking to get pregnant not to even begin the habit of taking alcohol. Since the alcohol is very addictive, and once you start, you will struggle to stop. When you're pregnant, you have a lot of cravings, and sometimes because you have developed an alcoholic habit, your craving will be for alcohol.
Yes.
So don't start at all. I think she's right.
Yes, she's very right. And you know, it's not only about, let's say, people without knowledge in health. Because I remember a colleague from work who could send people at the workplace to get alcohol for her when she was pregnant. Yeah, she was taking alcohol and the craving was so high that she couldn't. Yes, let me say, quote and unquote, take action. Or yes, she had a particular brand or pay.
Just so nyas ha brand.
This nyas brand and no matches and a whole ton. And after being exposed to fetal alcohol syndrome, looking at the child she delivered at that time, looking at the child she delivered at that time,
you can tell that.
I can tell that definitely. Yeah, this child was a child with fetal alcohol spectrum disorder. And like I was saying, it's not only about the facial recognition.
I mean, the brain development is important.
So, Obani say, who say Obana wabon, but Ubon say Obana started school no on Bonguma. Enkoye.
Yes.
What employ all the teachers? Hey, then I won't hear everything, but still. So it's not only about the clinical features. It's not only about the clinical features.
So beyond the clinical features, we're looking at the neurodevelopmental delay, the cognitive delays that become evident once you have gone down this path. And I agree with the last texter and also what Mavis is saying. It's a habit. Don't even start. And like our earlier caller said, the alcoholic companies or the beverage companies have done their part. They've put it there, not to be sold to pregnant women, lactating mothers.
But on that, you know, in Europe, when you want to buy alcohol, you enter a bar and you want to purchase alcohol. Sometimes they ask
for your ID.
For your ID.
Well, you see.
So can we get there as a country?
We will get there. I know particular places in Kumasi where I buy things from, where I have witnessed on more than one occasion, they deciding that they're not going to sell alcohol to this young person because he looks too young.
Oh, okay.
Yes, and I was really, really happy that they were doing that. Like the person was picking it up from the fridge, took it to the counter, and the man said, "Yen toma usa," but that's him. Somebody else is going to sell it. But you see, like Obapa was saying, if the person is a pregnant woman who is alcoholic, that's what small be. So no question.
Oh, she even says that, and you me dear, and you me kundi.
Oh, near share. Near share. Near share. Then she's now going to start drinking under the guise of "it's my husband."
Yeah.
Like somebody also said, what if the midwife is the drinking partner of the pregnant woman?
Oh, the midwife should not be your drinking partner. And you know, the midwife taking the alcohol, forget about the job. She is not pregnant. You are the one who is pregnant.
But she should know better.
She should know better. But you know, we are the keepers of our health. You should be taking care of your health yourself. We are all here to support you. But you know, your health does not belong to your healthcare practitioner. You own your health. So you make the step, we all assist, we come together and make everything better.
Alyssa is here playing with a DJ set that is not working. Can we diagnose her already? Can we diagnose her already?
Oh, she's just happy.
Can we diagnose my producer already?
They children or people with this condition also have poor memory. You will send your child. I don't know the tone. Just say, "What should baby?" Okay. It could be this fetal alcohol spectrum disorder.
Yes. And sometimes you send the child and he has to recite the thing on the way to going to buy.
By the time he gets there, if it's Maggie, it's now G.
It's a very serious thing what we're talking about. Please, don't start the habits. Don't mention your cry. If you are in it, get help. If you are in it and you are pregnant, get more help.
Yes.
Because what will be coming as a result of your habits, you may not be able to manage it alone, and it becomes burdensome on society because the expenses, the cognitive challenges, the skeletal challenges, all these things are going to make life very difficult for you and for everybody around you. Anyway, Final words before you go. It's 10 o'clock.
Oh, okay.
Can you imagine?
Okay. So, just to crown it all, if you have delivered a baby or you have a child with fetal alcohol spectrum disorder, please, that is not the end of your life. You can seek for therapies, education, and behavioral support. Families, support these kids, and also support families with these kids. Yeah, because by the time you realize they are throwing the babies away, so let's offer all the support we have.
All right, and that's a good note to close today's show on. My guest this morning has been MAVIS ASANTE, specialist nurse, neonatal in training, midwife guru of Mankanso Government Hospital. You can tell she knows what she's talking about. And that brings us to the end of today's edition. I really hope that you have learned something. Good morning to our regulars, Papa Kente, Lizzie, and Obapa. Alyssa will give you something. She'll organize something for you. Yeah. See you again on the Orange Healthline next week, Saturday. We'll be here to bring you another, educative session. Thanks to my guests, Mavis, you've done a really good job. People have learned a lot this morning. And thank you to Alyssa. Your watch is on the way. Bye. Enjoy your show. We're going to give you some really good music from now till, the rest of the day. Stay tuned here on Orange 107.9. My name is Dr. Jima. Have a lovely Saturday. Bye.